Hi, this is Dr. Kelly Miller, Saving Your Brain. You know, one of the things about me, or I'd like to share with you, is I'm a lifetime learner, and I love to learn things. I love to learn how I can help people better, and I'm always looking for better ways and things are out there. I'm always looking for cutting edge things that are happening in healthcare. And one of the things I want to talk about a little bit about stem cells and exosomes, okay, because there is a ton of misinformation out there. I just talked to two patients, and one of them is getting stem cells intranasally, but she has Alzheimer's. Okay, stem cells cannot pass through the blood-brain barrier. I'm going to say it again. Stem cells cannot pass through the blood-brain barrier. If you have a brain-related problem and you're getting stem cells, unless you're getting injected into your cerebral spinal fluid in your lumbar spine, they're not going to reach that, okay? And the reason is the blood-brain barrier has a threshold of 3,500 Daltons molecular weight. Stem cells are like 15,000 to 35,000 Dalton. It's not going to happen. I wish it were true. And I've had many patients that have gone to Mexico and Panama for their children or themselves and tried to get these stem cells. Again, it's about quality and quantity. So let me just educate you about stem cells first, and we'll get into more into exosomes. When I was 50 years old, I had stem cells taken from my iliac crest and my love handles mixed with my blood and injected into my left shoulder on a Thursday. The day before Wednesday, I had a complete rotator cuff repair. What that means is they drill a hole in your body, put a metal shaft in there, they get some Teflon, and they tie your tendon down to it. So the process, you're in the immobilizer for 5 weeks. This is the exercise you do for 5 weeks. This is the way it is, and it's going to take you 8 months, you know, on average, could be more, to rehabilitate that shoulder with all these exercises. So in my case, I wore the immobilizer for about 10 days. I actually worked and saw patients. I probably saw 40 patients on that Monday, treating them as a chiropractor. In 10 days, I had probably 80% range of motion back in my shoulder. Now, I still had to do those exercises, but my functionality with that was accelerated 300 or 400%. So that's the power of stem cells. If you use your own, that's still viable. But at 70, I don't have enough stem cells. I probably got 1 or 2% of what I had when I was a kid. Even at 50, my number were down, but I still got a very positive result. So today, we get stem cells from the umbilical cord of scheduled C-section deliveries, and these women are screened meticulously to make sure they don't have any diseases, no HIV, no hepatitis, anything. So, but you know there's not enough of these to supply the world's needs. So they take those stem cells and they grow them in a lab. They grow them vertically. And so what you have now is you have first generation, second generation, 10th generation, 20th generation stem cell. And just like our body, occasionally when we make a new cell, sometimes it's not the best and we have to get rid of that out of our body. So the problem with stem cells is they contain DNA. So potentially you have because you don't know if that's the first generation or the 10th generation or the 20th generation, you potentially have a corrupt DNA that could be in someone else's DNA in your body. We don't want to do that, okay? So let's talk about exosomes. Exosomes are produced by all cells. Even plant cells produce exosomes, but they will not regenerate our body. So I've seen things out there in the market. Oh, we have plant exosomes. Okay, it's not going to fix you. Okay. The advantage to stem cell exosome is they can become they can become anything. But what exosomes are extracellular vesicles that come produced by the cells, and they carry proteins, lipids, and nucleic acid, and they go into a cell and they help organize that cell and help it grow the cell and change the behavior of that cell. So exosomes are very small. They can pass through the blood-brain barrier. In fact, there's been lots of research out there showing in traumatic brain injury, in post-stroke brain injury, in the aging, dementia, Alzheimer's brain injury, and in the autism, that these exosomes can be taken intranasally or through IV. And in Israel, for example, they do 50-50, and there to make sure they cover the pathways. But these are the different, this is the way that you're going to get to the brain, through the exosomes. Having said that, not all exosomes are created equal. The exosomes we recommend for people are produced by a company called Chimera, which is here in Florida. Chimera has so many positives. So, for one thing, they have the only pre-COVID stock of stem cells in the world. They had huge reservoirs of that. So they have pre-COVID stem cells producing exosomes. Two, they're under the third stage of FDA clearance, just like a drug. So what does that mean? That means that every exosome has to be identical coming out of that company. And they have to have third-party lab testing, and it has to be verified by the FDA. Okay, nobody's out there else is doing that. So the other thing, so this is I have a chart up on my website under exosomes, and we have Chimera compared with 5 other biggest producers of exosomes in the world. And what we find is that Chimera has 5,000 times more messenger RNA and microRNA, which is essential to pass through the blood-brain barrier and make changes. 5,000 times. It's bioavailability, 5,000 times. So the stats are up there. So, you know, I don't work for Chimera, I'm not doing this, but I'm just saying, would you not want to get exosomes that had 5,000 times more RNA and bioavailability than the next one? Of course you would. So again, this is just information that's out there or is not out there, and even the doctors who are recommending stem cells and exosomes don't know a lot of this information. So how do we know you're getting exosomes? So one of the things I've done, and I through the years I have recommended people to get stem cells and exosomes, and some people got some great results, and some people got some so-so results, and some people didn't get no results. And that really confused me. The person who had got the exosomes would say, okay, you're getting 200 million stem cells and 500 million exosomes, okay? Well, how do they know that? All right, well, I didn't know then, but I know now that the only way you can count an exosome is through a very sophisticated electron microscope called a nanosite. They cost like $50 million. There's probably only a half a dozen in the world. So all these people, suppliers, don't have a nanosite. They're just guessing. They're probably counting it with a particle counter, which you could have dead cells, partial cells, but that doesn't tell you. So when we get these exosomes for people, they're in the trillion, 1 trillion cells, which is counted by the nanosite. So we have quality assurance there. And again, just to let you know, this is very exciting technology. 20 years ago, the FDA certainly wasn't clearing stem cells. They're the only use for stem cells and exosomes at this point is for cosmetic and oral use. But again, what we're talking about is what the literature shows, what the different research progress, different projects are demonstrating with people, and so you can make that decision for yourself.